Hi, Belen. Good
Hi,
afternoon.
Miss. Good afternoon.
Okay, let's just wait a minute for your classmates and then we'll continue. Okay?
Okay.
Okay. Ale, how are you?
Hi, teacher. I'm fine. How are you? Hi, Belen.
Very well, thank you. Oh, oh, good. Hey, Vanya. Okay, I think we can start. Okay, last class we just stopped in the pregnancy part, right? And now we have to go ahead with the respiratory system. Belen, could you read this part, please?
Okay. The respiratory system. Cough is a common symptom of upper respiratory tract infection, URTY, and lung disease. A cough may be productive where the patient cough is often described as loose and non-productive cough as dry. Sputum or phlegm may be clear or white, mucoid, yellow due to the presence of pus, or purulent, or blood is stained as an hemoptysis or hemoptysis, I don't know.
Hemoptysis.
Hemoptysis, okay.
Thank you, Belen. So it's just a part to remember, right? Don't forget these letters that are important. How is it common to call in abbreviations in your consultation in Spanish? Do you remember? Infections of the respiratory tract.
I thought it's ear. I
Okay. In Spanish, can you tell us what does it mean?
IRA, infección respiratoria aguda.
Yeah, that's good. Okay. So I don't know if you have any questions about this part on vocabulary, especially.
No, miss.
Okay,
No, miss.
Thank you. What about you, Vania? I think she's working. Okay. Let's continue then. I need 2 people for this chat. Maybe Ale and Vania, can you do it? I think she won't be able to do it. So Ale and Belen, please, can you read this part?
Yes.
Okay, Vania, don't worry. She's okay. Please, guys, who's gonna be the doctor and Mr. Hamilton?
I will be the doctor.
Okay. So Belen, please, Mr. Hamilton.
Okay.
Thank you.
How long have you had the cough?
Oh, for years.
Do you smoke?
I used to smoke heavily, but I gave up a year ago.
Do you cough up any phlegm?
Yes,
What color is it?
usually yellow.
Have you ever noticed any blood in it?
No.
Any problems with your breathing?
Yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back.
Okay, thank you guys. So just in this part, phlegm, okay? I know it sounds like you cannot pronounce, but it's a little bit easy when you try. Then the doctor writes in the patient's case notes, as you do, I hope. CO, dyspnea and cough, purulent sputum, 4 years, no hemoptysis. And note, the noun phlegm is pronounced phlegm, just as we said. Okay, I don't know if you have any questions in this part. And hello, Lily, I think she's here with
Good
us.
afternoon, teacher.
Good afternoon.
Excuse me.
Don't worry. I don't know if
don't-
you have any questions.
No, teacher, I don't have any question.
Okay. Let's continue then. And the auscultation part. Lily, can you read this part for us?
Okay, teacher. Take deep breaths in, out through your mouth. Good night, say nighty night. Listening to the chest with a stethoscope may reveal the presence of sounds. Apart from the normal breath sounds, there are two main kinds of added sounds. Crackles, which sounds like hearts being rubbed together and suggests the presence of fluid in the lungs. Wheezes, which are more musical sounds like whistling and indicate narrowing of the airways. The sound of an asthma patient breathing is all called wheezes. The sound heard when the pleural surface are inflamed as in pleurisy is called a pleural rub. The doctor asked Mr. Hamilton to say 99 to check vocal resonance, which may be increased, as in pneumonia, or decreased and pneumothorax. After examining her Hamilton, the doctor adds to his notes.
Okay, thank you, Lily. And his note says, OE chest, early inspiratory crackles, both blank bases plus expiratory wheeze. And I don't know if you have any questions here, something that you cannot understood.
No, miss.
Okay. What about Ale, Lily?
I understand, teacher.
Okay.
It's okay, miss.
Okay, perfect. And let's continue. Oh my God, let's practice, okay? Can you do, or maybe it will be for tomorrow, okay? Or maybe no, right now. Okay, who is gonna be number one? Maybe Lily?
Okay, teacher.
Okay, try. Is your cough productive? What will be the answer?
No, teacher. I don't have cough.
Okay, but here, using words that are better known to patients, we're gonna find out here the answers, okay? Are the full, I'm so sorry. Yeah, I thought it was for choosing. Then we're gonna make it tomorrow, okay? Or on Tuesday, sorry. Let's go immediately to the other slides. Okay, this part is called skin 1. Someone wants to be a dermatologist, right? Who was it? I think Ale.
Yes, Miss.
Okay, so I think you will enjoy this part. And then we have some types of skin lesion, right? The medical term that we usually use will be in this column. The common word will be in this column, and the features we will find in this column, okay? We have a macule, that is a spot, it's a common word. Features, not raised above the surface of the skin, okay? That would be more like a description. The medical term papule, a common word, spot. Features, raised above the surface of the skin. Medical term, nodule, common word, lamp. Features, a large papule. Then we have vesicle, common word, small blister, and features, filled with fluid. Medical term, bulla, common word, blister. Features, a large vesicle. Medical term, pustule, we don't have a common word, and features filled with pus. Medical term, crust, common word, scab. Features, dried blood, etc., on the surface of the skin. And we have scales. The common word is also scales, and features a thin layer of epidermis separated from the skin. Then we have cicatrix, and in the plural form, we will find cicatrices. And a common word will be scar. The features, a mark on the skin after healing. Then we have nevus, a common word, birthmark. Features, a colored skin lesion present at birth. Then we have fleshy nevus, common word, mole. Features, a raised brown nevus. Then we have verruca, common word, wart. Features, a nodule produced by HPV. Then we have furuncle, common word, boil. It means a large pustule or skin abscess. Note, the liquid, often yellow, formed as a result of infection is pus. If a lesion is pustular, it is filled with pus. Okay, so we have, of course, the medical term, the common word, and the features. And I know you understand, but if you have any doubts, we can solve it together, okay? Any questions here?
In the word crust, in the futures, dried blood, it's like sin sangrado, dried blood.
Dried. Crust, right? Crust, scab, dried blood on the surface of the skin. It's like when you stop bleeding, and it's not humid. Do you understand?
Yes, teacher.
You say it in Spanish, please.
Sin sangrado, que no tiene sangrado, cuando paramos el sangrado.
Okay,
Stop
but
bleeding.
yeah, but the correct word will be like sangre seca. Okay, dried blood.
Thanks, teacher.
No problem. Another question. Okay, I think we have
No, teacher.
nevus. It's almost the same in Spanish. Do you understand that word? Anyone can explain to us?
It's like un lunar, right?
Yes.
It's not lunar, it's una mancha.
It's like a like a lunar. What is the meaning of nevo in Spanish? A lunar, right?
Right.
Yeah, that's nevus. Okay. Then we have another questions. Where is it? Can you tell me where will we find that word? Someone knows where is it? Oh, here, fleshy nevus or mole. Okay, it is a kind of nevus that has growth skin near, if you know what I mean. It's not on the surface of the skin, it's bigger, like carnoso. Any other question?
No, miss.
It's okay, miss.
No, teacher.
Okay. I think Vania doesn't have any questions either. Okay, let's continue then. Then we have rashes. And Ale, can you read this part, please?
Yes. A single skin lesion can be regular or irregular in shape. When there are many multiple lesions, especially macular or papules, the result is a rash or a spot in common language. For example, the rash of an infectious disease such as rubella. A rash is said to erupt or break out. My little boy has broken out in spots in a rash all over his body.
Okay, thank you. Can you read this part, Belén, please?
The following features of a skin lesion are usually noted. Location, size, shape, color, type. For a rash, note also distribution, widespread on many parts of the body, or localized on one part only. Grouping, scattered more or less evenly spread out or in the clusters, small groups.
Okay, thank you very much. So as we see here, we will describe the rashes, the kind of rashes, and the description, right? The location, size, shape, color, and type. I don't know if you have any questions here.
No, miss.
No, miss.
No, teacher.
Okay. Did you understand these words, right? Scattered and widespread. Who is with us? Oh, I think Vania goes away. Okay. Let's continue. Then we have the injuries to the skin. Here's an extract from a medical website. Okay, I'm gonna read the first paragraph. The second will read Lily. The third and fourth will read Belen. And the fifth and sixth will read Ale, okay? Mechanical injuries to the skin are divided into those caused by a blunt force, such as a punch from a fist, and those caused by a sharp force, such as a knife.
Injuries from blunt force and abrasions, also called a graze or a scratch, is a superficial surface injury involving only the epidermis, which has been removed by friction. A scratch is linear, as in a fingernail scratch, whereas a graze involves a wider area, as an abrasion caused by dragging parts of the body over a rough surface.
Okay.
A contusion, also called a bruise, is an injury that occurs when blood vessels in the skin are damaged. A laceration, also called a tear, is a wound involving both the dermis and epidermis. It is usually distinguished from penetrating or incised wounds by its irregular edges and relative lack of bleeding.
Injuries from sharp force. An incised wound, also called a cut, is a break in the skin where the length of the wound on the surface is greater than the depth of the wound. For example, a wound caused by razor blade. The depth of a penetrating wound is greater than the superficial length of the wound. For example, a stab wound caused by a knife.
Okay, thank you very much. So I think we have questions here for vocabulary, right? For example, what is it a sharp force? Do you understand that expression?
Fuerza aguda.
Yeah, that's right. Here says such as a knife, okay? Then we have a blunt forces. Do you understand that expression?
It's a non-sharp force, like it's not a sharpening, it's blunt. It's like, I don't know how to explain it, but it's not sharp.
Okay, okay. Like we are watching here, right? Could be a contusion or abrasion or laceration, but it's not sharp. That's good. Another word or expression that you don't understand. For example, graze or scratch. Do you understand that word?
Yes,
Can you say it for us, Belen?
in Spanish.
Can you explain it in English?
Okay, it's when I can give an example, like you are in a street and you fell down and then you have a scratch in your knee. It's something, yes, it's.
Okay, that's good. That's very good. I don't know if you have questions. Lily, I don't know if Vania is here or Ale.
No, teacher.
Okay. Ale, how about you?
Yes, Miss. What is want?
Wounds. Wounds are like, for example, when you fell down, you have a wound on your, maybe on your knee, like Ellen says, or when someone pushes you, you will have a wound, or when you have an accident, you will have wounds on your body because of the accident. Okay, they could be an open wound or not, but it will be on your skin. Do you understand more or less?
Yes, Miss.
Can you say it in Spanish?
Es como una lesión, tal vez, que puede ser abierto, cesada, algo así.
Yeah, but it's more like an herida. Okay,
Thanks, Miss.
problem. Any other question? Or is it understood?
It's fine, Miss.
Okay. What about Lily
Yes, teacher, I understood.
and Ale? Did you?
Yes, Miss.
Okay, let's continue then. We have a case report. Can you read it, Ellen, please?
Okay. A 9-year-old boy presented to the accident and emergency department after he stumbled and fell while running in a wood. He had received a blow to the head from a rock and had been scratched by bashes. On examination, a vertical laceration, a 1 centimeter long, was noted on the bridge of his nose just right of the midline. There were a number of superficial scratches on the right side of his forehead. His right upper lid was mildly contused.
Okay. Okay, thank you. So do you have any questions here? And someone can make a description of what happened with this kid?
Teacher, what means stumbled?
Okay. Where is it, Lily? At the
In the
end?
second line, emergency department after he stumbled and fell.
Okay. After he stumbled and fell. When you're walking on the street and then you suddenly find something in front of you, but you can't see it or you don't see it and just pass by, you have to pass over it and then fall because you don't see it. You didn't see it. Do you understand more or less?
¿Que trompezó?
Yeah, that's the word. Tropezar. Okay, so what is what the guy has on his forehead? Someone can tell me?
A scratch.
Scratch. Okay. Very good. And what is what happened with his nose?
He has inside wound in the right side of nose.
Okay. Okay, that's okay. Perfect. Do you have any other questions here of vocabulary?
No, teacher.
What about you, Ale? Do you have any questions?
No, miss.
Okay, Belen, do you?
No, miss.
Perfect. Then we have source. Ale, can you read this part, please?
Yes. The word sore is a popular term for many different types of skin lesion, especially infected lesions. A pressure sore is a skin ulcer caused by pressure. For example, the pressure of lying in bed for long periods, also known as a bed sore, or the cubitus ulcer. A cold is a lesion caused by herpes simplex. Note, the adjective sore means painful. For example, a sore throat.
Thank you, Ale. Then denote the adjective sore means painful. For example, a sore throat. And do you remember how is a decubitus ulcer? Where is on the same reading. It's a lesion of pressure of lying in bed for long periods, right? Do you understand the word source?
Yes.
Can you explain to us, Belen?
In English too?
If you can.
Okay, it happens. Well, and see, something that always happened to us is when you're brushing your teeth and you have a little, when you, how can I say it? You hurt yourself.
Yeah, you push.
Yeah, yes, you push. And
Brush.
yes, with your teeth brush, and then at the next day you have a sword and it hurts a lot.
Okay. In Spanish, can you tell us what is it?
Como unas aftas.
Yeah, but the translation that you will find is more like llagas. That it will be like a synonym, right? Because it's caused by a friction or the long periods of state with pressure and scratches, or caused by herpes simplex, right? Do you have any questions here of vocabulary?
No, teacher.
No, miss.
How about you, Ale?
No, miss.
Okay, continue then. The urinary system. Now I want Lily, please, and Ale to make this conversation. Ale, you will be Mr. Jones in this case, and Lily, you will be the doctor, please.
Doctor, are you having any trouble with your waterworks?
Well, I do seem to have to go to the toilet more often than I used to.
How often is that?
It depends, but sometimes it's every hour or even more often.
What about at night? Do you have to get up at night?
Yes, nearly always 2 or 3 times.
Do you get any burnings or pain when you pass water?
No, not usually.
Do you have any trouble getting started?
No,
Is the stream normal? I mean, is there still a good strong flow?
mm, perhaps not quite so good as I used to be.
Do you have ever lose control of your bladder? Any leaking or dribbling?
Well, perhaps a little dribbling from time to time.
Have you ever passed blood in the urinary?
No, never.
Okay, thank you. Here, have you ever passed blood in the urine? Don't forget about that. Urine is formed in the kidneys and stored in the bladder until it is passed or voided. Belen, can you read, please, these boxes?
Patients may say, I have some pain when I pass water or pee. Doctors may say, are you having any trouble with your waterworks?
Okay. So I don't know if you have any question of vocabulary here or maybe some phrase that you don't understand.
What is leaking and dribbling, miss?
Where is it?
Is on the doctor says, do you ever lose control of your bladder? Any leaking or dribbling?
Okay. Any leaking? Leaking means a small amount of liquid falling, like drop by drop. Do you understand the meaning?
Yes,
Can you say it in Spanish?
es como incontinencia, right?
Yeah, but leaking means a falling water, a small amount of water falling drop by drop. So it has an own meaning. Gotear,
Okay.
and dribbling. Someone found this word? Maybe.
I don't know, but it remembers me a basketball position.
Like
Like,
dribbling, botar, rebotar, right?
mm, yes, but the players are más o menos como arrodillados, algo así, mientras están dribleando. Pero, I don't know.
Okay, dribbling, it's an action of push the ball, right? Against the wall. Like you said, rebotar, botando la pelota, right? And licking is gotear. So it is common to understand in context that we are talking about what, Belen, did you say before?
Incontinencia.
Right, right, that's good. But licking is not the same as dribbling, okay? But it's in context, you can use both to describe incontinence in this case.
Miss, I found the word dribbling on urine, and it says like post-void dribbling occurs when urine remaining in the urethra after voiding the bladder slowly leaks out after urination.
Okay,
It's the
it's like
same.
incontinence, right?
Right.
Or incontinence, sorry. It's that, because after you go to and left to fall out urine, a small amount of urine stays at your in your bladder, and then a small amount will go out, right? That's incontinence. So that's good. We find out the words. Any other doubt?
Yes, Miss, what is voided?
Voided. Okay. Stored in the bladder until it's passed or voided, says here. Voided will be taken outside of the bladder. Do you understand the meaning? When you left to go out the urine.
Yes, I got it.
Okay, because in the translation, what did you found at the dictionary? It's like, let me check. It says anulado, right? It doesn't make sense. But in this context, voided is a past urine. When you let to pass the urine or void it, okay?
Yes, Miss.
Okay, any other question?
What means streamed? When the doctor said it is extreme normal,
In which line, please?
line 11.
Okay. Let me check here. Is the stream normal? Stream usually it's like arroyo, if you found the translation, but in this context will means el chorro. That if it's normal or not, if it's continued or it makes pauses. The flow. Do you understand now?
El chorro miccional, más o menos.
Yeah, that's what it means. Any other question?
No, miss.
No, teacher.
Okay. Ale, did you get it?
Yes, miss.
Okay. Then we have the common urinary symptoms and their definitions. We have frequency, that will be the frequent passing of urine. The dysuria, burning or scalding pain in the urethra when passing urine. Nocturia, urination at night. Urgency, urgent need to pass urine. Hesitancy, difficulty starting to pass urine. Urinary incontinence, involuntary passing of urine. Hematuria, macroscopic blood in the urine. Are you agree with these definitions? And if you know another maybe word that you usually use to describe these characteristics?
In the first one, in frequency, could be polyuria, but
Okay.
I don't.
Yeah, it's okay. What else? Or maybe some word that is not here and you usually use.
Glucosuria could be the presence of glucose in patient with diabetes.
Okay, that's good. With the color we have, or it's hematuria? No, it's another thing, right? Did you check the color of the urine?
Yes, so we don't see that actually. They say that I think that the biochemics,
The lab, right?
lab, yes.
But they have maybe a word, a specific word to call that.
Maybe coluria.
Okay. But we will find in English. I don't think it's the same. It seems to be the same. Any other word? Or you have some questions about vocabulary here?
We also have anuria.
What does it mean, anuria?
When you don't pee or don't go to
At all?
urine. No, not at all. It's like less of 100 mLs. I don't know how to say.
Okay. Yeah, mLs. It's okay.
mLs. Yes.
Perfect. Some other word, or do you think you did everything?
Maybe a neuresis.
What is the meaning of that, Ale?
I could say it in Spanish. Could I say?
Can you try to explain or to describe it in English? Just try.
When a child lost urine at night.
Okay. And what was the name?
Neuresis.
Enuresis.
But
Okay.
in English, I don't know.
No, it's the same in English. I'm pretty sure of that. You did it good. Okay, I think it would be the whole words, right?
Tenesmo vesical.
Wow.
It's other word. It is when the patient has passed urine and he continue feeling need to pass urine. In Spanish, please.
Okay, no, try it again, Lily. It was so, I think you were good. Okay, just try it again in English and then we will do it in Spanish.
When the patient pass urine, but he persiste, continue with feeling ganas de orinar, no sé.
Yeah, the feeling of past urine again, or still passing urine. Did you understand, guys? Belén, Ale?
Yes, miss.
Okay.
Yes, miss.
Thank you, Lily. That was good. Let's continue then. Urinalysis. Can you read it, please, Belén?
Okay. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with the recommended strips. For example, clinicistics for the detection of glucose. More detailed tests are carried out in a laboratory on a specimen of urine. Typical specimens are midstream specimen MSU and a catheter specimen, CSU. Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by protein or cells. Pluses are used in case notes to indicate abnormal findings. A small amount positive is described as a trace. For a large amount, plus, it could be, the words gross or marked can be used. For example, gross hematuria. When there is nothing, the word nil is common.
Okay, thank you very much, Belen. I don't know if you have any questions here.
No, miss.
Do you understand the words reagent strips? Are those here? Okay. Ale, do you have any questions?
No, miss.
And you, Lily?
No, teacher.
Okay. Belen, you either?
No, miss.
Okay. Then we are good. Perfect. Just in time. I will share with you my questionnaire, please. Can you fill it for me? Oh, Vania, you're here. Okay, thank you very much. Who's gonna be the first one in next week? At 6 o'clock. No one?
I could be first.
Okay, Ale. The second one, 6:15.
I could be the second.
Okay. Lily. 6:30.
I can be the third.
Okay. Belen. And Vania, it's okay. 6:45. She cannot speak. Okay, guys, thank you very much. Have a good weekend and see you next week, okay? I will share with you a link of this class homework. I think you're gonna make it so fast. Okay? See you. Take care. Bye-bye.
Bye.